Hey, quick question before we start. Have you ever woken up at night and felt something strange and wondered, is this normal? And if you have diabetes or if diabetes runs in your family, some of those nighttime surprises aren't random. They're clues. And today I'm going to walk you through 7 nighttime signs that diabetes might be at play and then give you 7 practical science-backed tips to reduce overnight and post-dinner blood sugar spikes without starving yourself or cutting carbs completely. Listen close, because a few small changes tonight can mean fewer emergencies, better mornings, and a lot less worry. First, why focus on night sleep is where your body repairs, balances hormones, and clears the day's sugar. When blood sugar is off, the night becomes noisy, waking up thirsty, sweating, leg cramps, even nightmares. These are signals and they matter. If you notice several of them regularly, talk to your doctor. Don't ignore your body. Okay, the 7 nighttime signs, short, real, and easy to remember. Sign 1. Frequent urination at night. Nocturia. If you wake up more than once or twice to pee, that could be your kidneys flushing out excess glucose, and high blood sugar pulls fluid with it, and your body responds by making you pee. If your nights feel like quick trips to the bathroom, especially with increased thirst during the day, get checked. Sign 2. Intense thirst at night. Waking up parched isn't just dryness. If you're downing the water jug every night and still thirsty the next morning, that persistent thirst can be a sign your blood sugar is elevated and your body is trying to dilute the glucose in your blood. Sign 3. Night sweats, clamminess, or sudden hot sweating while asleep. This can mean two things: low blood sugar during sleep, nocturnal hypoglycemia, or autonomic dysfunction caused by long-standing diabetes. Night sweats that wake you up, especially with tremor, palpitations, or confusion, need urgent attention because they could reflect dangerous overnight low blood sugar. Sign 4. Tingling, burning, or painful feet and legs that feel worse at night. Diabetic neuropathy frequently bothers people during the night. Those pins and needles, numb patches, or burning sensations that make it hard to sleep. If your legs kick, twitch, or keep you up, consider neuropathy as a possible cause and discuss testing with your clinician. Sign 5. Waking with a headache, dry mouth, or foggy thinking. High overnight glucose can cause dehydration and poor sleep quality, leading to headaches or morning brain fog. If those mornings are becoming more common, it's worth checking a fasting sugar or an A1C. Sign 6. Nighttime hunger or nightmares. Sometimes low blood sugar wakes people up with intense hunger, sweating, or vivid dreams. If you're on insulin or sulfonylureas, this is a particularly important sign to track because it may indicate your overnight dose or timing needs adjusting. Use a glucose meter or a continuous glucose monitor, CGM, to confirm. Sign 7. Recurrent infections or slow healing skin problems that flare at night. High glucose impairs immune response. Sometimes infections, candidiasis, or skin ulcers feel worse or become painful at night. If wounds or itchiness aren't settling, get them checked early. If you recognize even two of those signs, don't panic, be proactive. Now, here's the practical, clinician-friendly part you asked for: 7 ways to reduce nighttime and post-dinner blood sugar spikes without strict carb cutting. These are evidence-backed strategies anyone can try with their healthcare providers. Okay. Tip 1. Mind the composition of your evening plate. Add protein and healthy fat with carbs. A modest portion of lean protein, fish, chicken, tofu, and a source of healthy fat, olive oil, avocado, nuts, slows gastric emptying and blunts the spike after a meal. You're not cutting carbs, you rechanging the company. The carbs keep. This slows absorption and reduces peak glucose. The ADA and nutrition reviews support mixing macronutrients to moderate postprandial rises. Tip 2. Add fiber-rich foods and resistant starch to the meal. Vegetables, legumes, and a small serving of whole grains or cooled rice, which contains resistant starch, slow carb absorption. Fiber is one of the simplest, safest ways to lower post-meal spikes and improve gut health, and you can do this while keeping your favorite carbs in moderate portions. Tip 3, move within 10-30 minutes after eating. A short walk works wonders. Multiple trials show light to moderate walking after meals substantially blunts the postprandial glucose rise. You don't need a gym. A brisk 10-20-minute walk after dinner can be one of the most powerful low-cost tools to lower that spike for people with mobility limits. Seated leg exercises or gentle marching in place help too. Tip 4, reduce late night alcohol and avoid heavy late snacks that are pure sugar. Alcohol can cause delayed hypoglycemia overnight or destabilize glucose, and sugary snacks late at night are quick sugar bombs. If you drink, pair it with food and check levels. Prefer a small, balanced snack, not cookies, if you need something before bed. Tip 5, use strategic portioning and timing. Smaller, evenly spaced evening carbs. Instead of a huge late dinner, split portions, a smaller main meal, then a light high protein snack before bed if needed. This evens out glucose exposure overnight and reduces large postprandial excursions that carry into the night. Tip 6, consider the timing of medication and insulin with your clinician and test if you're on injectable insulin or certain glucose lowering drugs. Timing matters. Some people benefit from adjusting the timing of a rapid acting insulin or taking a small snack to prevent nocturnal lows. If you use insulin, consider speaking with your provider about dose timing and think about CGM for overnight safety. Never change doses without clinical guidance. Tip 7, improve sleep quality and treat sleep disorders. They affect glucose. Obstructive sleep apnea, short sleep, or fragmented sleep worsen overnight glucose control and increase insulin resistance. Screening for sleep apnea and treating it with CPAP or weight loss can meaningfully improve blood sugar control. Good sleep hygiene, consistent times, cool dark room, limiting screens before bed helps too. A few bonus practical notes so you can put this into action tomorrow, not someday. If you're worried about overnight lows, test a bedtime finger stick at 2 a.m. check or better. A CGM trace will tell the story. If you wake up sweaty, shaky, or confused, check your sugar and treat suspected low with 15-20 grams of quick sugars, juice, glucose gel, and recheck in 15 minutes, then follow guidance from your clinician. For overnight high readings, write down the time, what you ate, and any medication changes. Patterns matter more than single numbers. If you're using the without cutting carbs approach, here's a simple sample evening routine that follows the tips we talked about. Dinner, a palm-sized portion of rice or pasta, a fist-sized portion of vegetables, leafy plus colorful, a palm-sized piece of salmon or tofu, 1 tablespoon of olive oil, or a small handful of nuts. After dinner, a 10-20-minute brisk walk. Before bed, if your bedtime glucose is trending low, have a small balanced snack, Greek yogurt, a small apple with nut butter, or a slice of cheese and whole grain cracker. Test if in doubt. And remember, the goal isn't perfection, it's fewer big spikes and calmer nights over weeks. Small, consistent changes lower A1C, reduce symptoms, and improve sleep. Quick safety recap. Don't self-adjust insulin doses without talking to a clinician. If you have kidney disease, be careful with certain supplements or extra protein. If you sleep alone and worry about severe overnight lows, talk to your provider about CGM alarms or partner alert. All right, final practical action items for viewers. 1. Tonight, try a 10-minute walk after dinner. 2. Add a small protein or healthy fat to your evening carb. 3. If you're waking thirsty or sweating at night, call your clinic and ask about testing. You might be picking up signs early. Small changes, big differences. If this helped, hit like, subscribe, and share with someone who wakes up thirsty or tired. Drop a comment with which night sign you recognized. I'll read them and follow up with deeper tips on dosing, CGM settings, and exact snack ideas in the next video. Take care, sleep well, and check in with your healthcare team.